When the tibial nerve is quite irritated in this region, it's helpful to milk some of the swelling out from around it. So you can do that by conforming your hand to the region of the tarsal tunnel. So I've got the chubby part of my hand here. On that side I straddle the retinaculum, and then this chubby part of my hand is on the muscle. And I just start off at the level that I'm just deforming the skin and the superficial fascia. And I compress and then recoil. Compress and recoil. After several minutes, then the fluid pressures begin to fluctuate down at the level of underneath the retinaculum and in the region of the nerve. So after several minutes, it looks the same, but it's feeling deeper and having a deeper effect. Another technique you can use when the tibial nerve is irritated through here is to just distract the ankle in a general sense. I'm holding onto the calcaneus. That's when I draw it towards me, it's going to distract the joint between the talus and the calcaneus. It also distracts the joint between the talus and the malleoli. So this is a way to introduce fluctuant fluid pressures deep inside the area that will often help to make the tibial nerve less irritable. You can do it in a tractional way with a complete recoil, or as things become looser, then you traction with just a little bit of release, but you maintain the longitudinal tension on the structures. Another necessary manipulation sometimes is to loosen the retinaculum under which the nerve and Tom, Dick, and Harry pass. So this is done a number of ways. That's the structure that gets tense as we evert the foot. So I tend to go away from where the nerve is, and I feel the retinacular attachment onto the bone, the periosteum of the calcaneus. And I hold on to that. I have a very minute amount of lubricant on my finger. I hold onto the edge of that and just gently peel it towards me or towards the sole of the foot. So this is a fascial immobilization that releases the retinaculum on its distal attachment here. And then after several passes, and I've got some release, then I can proceed a little bit more towards the malleolus and continue in this way. I want to check with my client that I'm not irritating the tibial nerve as I'm doing this. Is that about where the nerve is there, Trip?
Yep.
Yep. So if I really hook in there and drag, it's going to hurt like blazes. But if I just move about a millimeter over, and do you feel that on the nerve now, Trip?
Mm-hmm.
Yeah. So all you need is about a millimeter of leeway. So then you can introduce strong mobilizing forces transversely to the retinaculum without irritating the nerve. And then, whoop, we hop over the nerve, and it's often very helpful to dig in along the malleolus and release all of the retinacular attachments there. Once you've done this transverse work, then sometimes it's helpful to do a longitudinal stretch because we want it to actually be longer. And as I'm doing this kind of manipulation, my other hand is working to put an eversion force through the foot. Maybe if I don't have enough leverage here on a big foot, then I hold on to the calcaneus here. So I work longitudinally this way and introduce an eversion force. And of course this is probably a more challenging manipulation to all the structures underneath it. So you need to check in with your client while you're performing that manipulation.